You're watching the Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. Today's topic, the benefits of neurofeedback with the Clear Mind system. With us, we have Denise Hetrick from the Clear Mind Center in Sarasota, Florida. Welcome to the program.
Thank you.
Now, before we get into today's topic, tell me a little bit about the typical patient that you see there at your center.
Generally, we see patients from ages 5 to 95, and they can be children with ADD or adults with insomnia or mood disorders. Neurofeedback can help a wide range of patients with a variety of disorders.
Okay, and so let's begin with how does it work? What does the machine look like? How do you use it on the patients? And I know we have some video that we'll play.
Yeah.
But tell me a little bit about the machine.
EEG has been around since the 1950s, so around 70 years, and it's been refined over the last 70 years so that we could take the EEG from the hospital, we can actually refine that for neurofeedback and use that as a treatment, a non-invasive treatment for patients to actually retrain the brain to move at the proper speed.
Okay. And do they put on goggles or what do they do?
First of all, when a patient initially comes into the center, we put an EEG cap, a traditional EEG that they would get in the hospital, and we fill it up with gel. So that gel just sits on the scalp so that we can record the electrical activity from the brain. And what we're measuring is the brain moving too fast, too slow, or misconnecting or connecting.
Okay, and it's called a brain map?
Mm-hmm.
So it's a brain map, and what does it show? Like when you get is it a printout of the brain map?
Well, much like your iPhone, it shows full-colored pictures. So from those pictures, we can see if the brain's moving too fast, or if the brain's moving too slow, which was under-arousal, or if the brain is connecting or perhaps not connecting at all. So it's really a matter of how the information is being sent, or if the brain is hyper-aroused or under-aroused.
Okay, so if you see this, what do you do with the findings?
Well, it gives us a protocol. So our system is automated so that it takes the guesswork out of the protocols, so that we can actually target the area of the brain that needs treatment in terms of, for example, if a patient is having issues with insomnia, the brain is generally moving too fast in a certain area of the brain.
Okay.
Neurofeedback, through retraining an operant condition, can teach the brain how to slow down to the proper speed.
Okay, so there's techniques. So the patients, once you identify which part of the brain, let's say is sped up, then you do it with behavior modification, or they're doing it while they're using.
Well, when a patient comes in, we'll do the brain map, and after we go over the brain map, it'll actually give us a protocol. So, for example, if a patient is having issues with sleep, the parietal lobe in the back of the head might be moving too fast. So we would actually put 2 sensors on the back part of the head that would measure the frequency of the brain, and the lights would actually teach the brain how to move at a different speed. When the brain actually accomplishes the correct speed, they get a reward. So the reward is watching a movie and making the movie play. So in essence, the brain is in a big feedback loop with the computer. It doesn't realize it has these sensors on, it doesn't realize it has these flashing lights, but what the brain is getting is signals. And it's this repetition of the signals that allows the brain to actually begin to duplicate the signals. And over time, a complete series is 20 sessions, the brain can actually duplicate those signals on its own, and the treatment's permanent.
Okay, good. So it is permanent. I mean, the people that couldn't sleep can sleep. People with anxiety, depression, I mean, you're seeing some reversals?
Absolutely.
Is it now? How do you get the customers? How do you get the patients? How do you get them to come see you?
Well, most of our patients are interested in a non-drug approach. So these are patients that have taken medications and perhaps had adverse reactions to medication, or they don't want to take medication, and they're looking for a natural therapy.
So how is it different than the other machines on the market?
Our system is an integrated system that allows the brain mapping system and the photic to come from one complete system. So it interacts with itself and automates the database and is a complete system that is easy for the doctors to follow.
Okay, and there are medical doctors using this technology. This Clear Mind system is what it's called?
Yes.
Throughout the country?
Yes.
Where about?
And internationally. I think we're just about in every state, and we're in many different countries throughout the
Okay,
world.
and the results? Because I went to the website, and if people go to the website, you can see the testimonials, and people say that it works, and they feel better. And so give me some stories of patients that have used this, and it's helped them.
Well, for disorders such as anxiety and depression, the results are high 90s. Things like
Like high
insomnia.
90s mean 90% of the people get better?
Correct.
Okay.
And for things like insomnia, and even disorders like tinnitus, neurofeedback can be very helpful.
Tinnitus, like where? Where?
Ringing in the ears, migraines,
Okay.
seizures. Neurofeedback can be very helpful for
Who's
those.
the ideal patient that you would see?
Well, I think any age with we all have these issues, whether it's anxiety or depression, at some time in our life. So, we treat a lot of children with ADD, learning disabilities, and kids are very fast. Their brain is very young and malleable.
So it's a relaxing setup. So take me through the process. Okay, so somebody comes in after the consultation. Is this discussion done over the phone, whether or not they'd be a candidate or not? And then, take me through the process.
Well, every clinic is set up differently. So many anti-aging doctors will deal with an older population. They might be dealing with memory loss, insomnia, mood disorders, anxiety. Those are top candidates. A family physician might be dealing with a wide range of patients from ages 5 into their 90s. And with children, it's very effective for kids because kids enjoy the therapy and it makes them feel better. And the therapy is also very fast. So we like to say that the brain is a learning machine.
Okay.
So the brain can take this information and begin to duplicate those signals immediately. So people very often feel relief on their first session.
And it's about a 30-minute session.
30-minute session.
And where can they go to find out more? Is it pretty much they go to your website?
ClearMindCenter.com.
So this machine. So you don't do the therapy, but you give it to doctors.
Yes.
Is that right?
Yeah.
You're a distributor?
ClearMind Center sells equipment to doctors, and we train and do a clinical setup for neurotherapy.
Okay. Well, I want to thank you for coming on the show. Very interesting. And if they want to learn more, they could call your center, find out about the machine. Other doctors, they may want more information as well.
Sure.
So they just go to your website. Is that the best place?
Yes.
All right. You've been watching The Wellness Hour, leader in medical news and information. We'll be right back.